going to hold her middle finger, and we'll have to hold the medial and lateral as well as the anterior aspect of that finger. And we're going to do this for about 2 to 4 minutes and see what happens, okay? So I'm going to take and hold the top and bottom here, just static pressure. Now the more pressure you use, again, the better the result. So how much discomfort with that amount of pressure right there in your finger?
4.
About a 4. On a scale 1 to 5? Okay. So I'm going to hold this for maybe 2 minutes, and then I'm going to hold the medial and lateral aspect, because we need to get not only the anterior aspect in her case, but I think we need to get the medial and lateral aspect of that third zone. I'm on the third zone. Third finger is the third zone. And so let's see if we can facilitate a response in her knee just by holding her finger. I know it's a little interesting. It seems almost unreasonable, doesn't it? But this should validate to some degree that we can, there's non-cellular fluid flowing through her body. Non-cellular fluid, another name for that is energy. You think of a zone, you think of a meridian, same thing. The wonderful thing about zones is they're straight lines. Meridians aren't straight. If you have to try to follow a meridian line, it's confusing. That's what I love about Dr. William Fitzgerald's system, is that it's simple. How many of you have the intellectual capacity of a 5-year-old? At least? Everyone in the class? If you have the intellectual capacity of a 5-year-old, you should be able to do this. And if you don't, then find a 5-year-old that can help you. So we've been about 1 minute, 30 seconds. And does your knee hurt only when you're on it? No matter where you are, lying down, standing up, sitting down, when does it hurt? When you move it. Okay?
Now, did you say the back of the hand is the front of the body?
Back of the hand, or the top, okay, the palmar surface is the back.
Is the
back of the body.
Okay.
The dorsal surface of the hand is the front of the body.
Okay. Okay. That's what I wrote down, but for some reason I'm second guessing myself.
Okay, so we've been about 2 minutes there. I'm going to now take my fingers like this and hold that way. Is that a little sensitive right there?
Yeah.
More sensitive, isn't it?
When you say that way.
Now I'm just taking my fingers like this and clamping down, just static pressure like that, because believe it or not, about 2 to 4 minutes of this, your hand will get a little tired.
Yeah.
Especially with the pressure that I'm using, which is quite a bit. But more pressure, the better the result. And so we're going to go for a total of 4 minutes and see what is left. We're at 2 minutes and 47 seconds. How is this getting less sensitive, or is it about the same?
It's about the same.
Okay, no worries. Well, just think, I didn't have to actually work on your foot yet. Well, that may be good news, huh? She may need that other perspective to help her see that this isn't quite so bad. Yeah. Kind of like, oh, we got to stay here till 10 o'clock? Yeah, that's right. Well, how about we stay till 12 o'clock now? 10 o'clock looks a lot better, doesn't it?
You get the same reaction if you just slam your finger in the door?
No, I don't think so.
It's static pressure.
Yeah.
It's continued pressure.
Continuous pressure is what you need, that's right.
But you never use static pressure on the feet, though?
I don't, because it is a little tiring. Yeah. I only do this on the hands. And sometimes the feet, like you can do the same thing through the toes, on the distal joints of the toes, but the main reason I don't do it is because it's tiring. It's very fatiguing to the hand. You know?
So the analgesic, where you were doing that with the pinky, is that just for that zone?
It is.
Okay, so what you're doing here is
It's just
analgesic zone for her knee.
Third zone for her knee.
Okay.
She said her pain's here. I had to
Right.
determine where I think it is, and then I see what the fingers have to tell me.
Okay.
So we've been now 4 minutes and 13 seconds. Now,
She's ready to move that finger.
you can use that to unlock your car door now. So, would you move your knee or stand up and do whatever you have to do and tell me if that changed your knee at all?
Okay, that's awesome.
Don't you want to give him a hug?
Is that all gone now?
Yes.
Pretty cool, huh?
That's so awesome.
Wait, turn sideways. Claire, is her nose growing? So, really, it's all gone? I'm not surprised, I just want to clarify. So that's interesting, isn't it? We've seen how we can use pressure on the fingers. Now, if that knee pain comes back, guess what you're going to do? Yeah, the same thing I just did.